Hi, I'm Dr. Stephen Cohen, an internist working in Austell, Georgia, a suburb of Atlanta. My goal today is to teach you how to use a tool on the website Medicare.gov to potentially save thousands of dollars a year on your costs for medicines. If saving this much money for yourself, your relatives, or your friends on Medicare sounds appealing to you, please join us. Sometimes picking the right plan could save your life. My mother, Dot Cohen, was an active volunteer in the Atlanta community. At the age of 73, she was the oldest person to take part in a 60-mile Komen walk to fight breast cancer. 2 years later, she was dying from lung cancer. Before Mom's death, she received a prescription for an expensive medicine that wasn't covered by her Medicare insurance. After she died, a cancer specialist told me that none of the 40 Medicare plans in Atlanta paid for that medicine. His patients only received it if he could get a donation from a drug manufacturer. Otherwise, they had to settle for a less effective treatment. It took me 3 minutes in front of a computer to show him that some plans did cover it, and that the out-of-pocket cost could vary from $6,000 per year, which is a lot of money, to $79,000 per year, which is a lot more, depending on what plan was chosen. Most people can only change their plan during the open enrollment period, which runs from October 15th through December 7th each year. If you are already on a Medicare Advantage plan, you can also make insurance changes from January 1st through March 31st. During this time, you can change your Medicare Advantage plan to a new Advantage plan or switch to traditional Medicare and pick a Medicare D drug plan. We'll be explaining the differences in these insurance plans in just a minute. There are several exceptions to this deadline. If you're turning 65 in the coming year, you'll have some additional time to apply for the plans. There are several other situations which permit a person to enroll in a Medicare D or Medicare Advantage plan outside of the dates of October 15th through December 7th. If you put it off, you'll have to wait another year before you can do this. In my job as an internist, a physician caring for adults, I've taken care of thousands of adults on Medicare. Unfortunately, I've also seen people on Medicare have trouble paying for their medicines. I recently spoke with a woman that I've been seeing for many years as a patient. She tearfully told me that she would be leaving the area. She said that she was not able to pay for the cost of her mortgage, her food, and her medicines. Because of this, she was moving to another state where she would be living with relatives. Some Medicare drug plans don't require a monthly premium. Despite this, over 7 million people on Medicare have not chosen a plan that can pay for their medicines. I've taken care of patients with cancer, kidney failure, and other medical problems who saved thousands of dollars per year when they signed up for a Medicare drug plan. Some of you may not want to watch this entire video. You can print off a flyer to share with friends or relatives, which explains how people can lower their Medicare costs. Go to the Resources tab of MedicareDrugSavings.org and download the flyer. Remember, as we go through this exercise today, the best plan for you is going to depend on what medicines you're taking. One insurance plan may be better for you, while another may be better for another family member. I'm going to show you how someone taking 8 medicines could lower their costs from $34,000 to $4,000 per year if they choose the right insurance plan. In this example, someone who did not pick a plan to cover their medicines would pay $84,000 per year. We're mainly going to be talking about the Medicare D prescription drug plans and the Medicare C Advantage plans today. When you hear Medicare D, think Medicare drugs, since the Medicare D pays for medicines. But before we do this, let's talk about the different types of Medicare coverage. Medicare A helps pay for inpatient care in hospitals and nursing homes. Medicare B covers outpatient care. Medigap plans are sold by private insurance companies. Medicare C, these are the Medicare Advantage plans which are offered by private insurance companies. The premiums and covered benefits can vary between plans. They may provide additional benefits like vision care or dental care, which aren't covered by traditional Medicare A and B plans. However, they may limit which doctors, hospitals, and pharmacies you can use. Medicare D plans are the main subject of our talk today. Your annual costs for medicines on a Medicare D plans include 3 things. There's the monthly premium. This is what you have to pay the insurance company every month. There's the copay. This is what you have to pay each time you buy a prescription. The copay will vary from one medicine to another. Deductible. This is how much you have to pay before the insurance company starts paying for the medicines. Some insurance companies have a deductible and some don't. This is important because if you sign up for a plan which doesn't cover your medicines, you'll either have to switch to a different medicine or pay for the medicine yourself. Before you sign up for a plan, you really need to decide if a Medicare D plan is right for you. Since most people on Medicare spend a lot of money for medicines, the answer is usually yes. However, some people keep insurance benefits from their job after they retire and go on Medicare. This insurance may continue to pay for medicines after going on Medicare, so there's no need for a Medicare D plan. If you have this from your job and enroll in a Medicare D plan, you may lose the previous insurance you had from your job or union. And if this happens, you may not be able to go back to the insurance from the job. So if you're in this situation, you need to be very careful before choosing a Medicare D prescription plan or a Medicare Advantage plan. Some people may not need a Medicare D plan because they have drug coverage through TRICARE if they previously served in the military or through an Indian health plan. So there are hundreds of insurance companies which cover different medicines, charge different premiums, and different copays. How can you ever figure out which plan offers the best value? Well, be patient because we're going to be getting to that very soon. In every state, there is a free program which provides one-on-one counseling about health and insurance programs. This is the State Health Insurance Assistance Program, also known as SHIP. To find the SHIP in your state, go to shiptocenter.org. Click on SHIP Locator. In this example, we are picking Georgia, and you see how to contact the Georgia SHIP program. Okay, let's get started. Go to www.medicare.gov and click on Find Health and Drug Plans. Here you can log in or create an account. If you are on Medicare and would like to make an account for Medicare.gov or have already done this, click on Log in or Create Account. This lets you save your medicines in a list so you don't have to re-enter them when you come back to the site. This may also let you see medicines you previously received from a pharmacy, which can help you come up with an accurate medicine list. If you are not yet on Medicare or don't want to register for an account, click on Continue without logging in. If you do this, you cannot save your medicine list. In this example, we're going to continue without logging in. Enter the type of insurance you are interested in, Medicare Advantage, drug plan, or another option. Most people will want to pick the first two choices, but you do have other options. Enter your zip code. Enter whether you get help with your Medicare costs from Medicaid or other programs. Click Next. You are now asked if you want to see drug costs when you compare plans. If you are taking routine medicines, you should click Yes. This does not include temporary medicines such as antibiotics. This lets you find the least expensive plan that will cover your medicines. If not taking routine medicines, click No. Choose how you fill your prescriptions. Click Next. Enter the name of your medicine. In this example, we are entering glipizide. Click on Add Drug. You may be asked if you will take a generic medicine. Since generic medicines usually work as well and are less expensive, I would advise saying yes if given this option. Enter the dose of glipizide, 5 milligrams, the quantity, how many pills you get in a prescription, and how often you fill the prescription. In this example, you are getting 30 pills every month. Click on Add to my drug list. If you are taking another medicine, choose Add another drug. Repeat this until you have entered all of your medicines. After they have all been entered, click Done. You then see a screen that asks you to confirm your drug list. For this example, I have entered 8 drugs. Click Done adding drugs. You then have the option to choose 2 local pharmacies. We're going to choose Rite Aid and Walmart. You can use other pharmacies, but this will let you see if the pharmacies you choose are in-network for the insurance plan. Using an in-network pharmacy can lower your costs. Click Done. We are now looking at the 28 Medicare D drug plans. Arrow 2 gives you the option to see the 33 available Medicare Advantage plans. You can sort the plans by lowest drug cost or other options. We are now looking at the 33 available Advantage plans. You can select plans which have additional benefits, such as dental care, eye care, or hearing aids. You can select plans for people in special situations, such as being on Medicaid or being in a nursing home. Click on Star Rating to learn about the insurance plan's rating. You can enroll online or click on Plan Details to learn more about costs, benefits, ratings, and contact information. We are now looking at the comparison between 2 Advantage plans. You see information on deductibles, cost of doctor visits, and estimated annual cost of medicines. In this example, The annual cost of medicines on the AARP plan is $4,000 per year, while the WellCare cost is $34,000 per year. The 7 million people on Medicare who have not selected a drug plan would pay $83,000 a year. You can also compare the cost to the results you get from a Medicare D plan search. It's important to realize that if you pick an out-of-network pharmacy for your insurance plan, it will give you an inflated cost for your medicines. Remember that we picked Rite Aid and Walmart in this example. The search results show us that the annual medicine cost on a Kaiser plan is $83,000. This is because Kaiser will not pay for medicines at Walmart and Rite Aid. If you enter the Kaiser pharmacy instead, you find the annual cost of your medicine drops to $2,300. Remember, this gives you an estimate, not an exact amount for your annual medical expenses, since you may go to the doctor or be hospitalized more than other people. You can learn more about resources that can help people pay for their Medicare and medicine costs on MedicareDrugSavings.org. We know that finding the least expensive plan is complicated. I suggest you follow these steps to find the plan which is best for you. Write down all of your routine medicines. Watch our video. Print the guide under the Guide tab on MedicareDrugSavings.org and refer to it when you go to the Medicare Plan Finder on Medicare.gov. If you need help, ask a friend, a family member, or an insurance agent. Remember, you can always get one-on-one help in your area by contacting the State Health Insurance Assistance Program.